Meeting is being recorded. We'll be doing CHAS for the next 60 minutes, and there again, let me reiterate, once we finish today's session, this session will be put on the ACE portal. Okay, introduction to CHAS, Clinical Healthcare Application System, List Manager Application. Okay, we're going to put, purpose of this session is to provide a brief overview of the List Manager application, the two reports, dynamic and static, and their functions. Okay, in the previous session we covered the following: CHAS getting started, setting preferences within dashboard, appointment module and subunits within the appointment module, successfully creating and edit clinic health teams, and using patient summary module to track overdue clinical services. Okay. Upon completion of this lesson, the student will be able to access List Manager module, identify the CHCS keys required for List Management module, identify the difference between dynamic and static list, create a My Patient list, create a static report using advanced filters, save a static report using advanced filters, edit a static report using advanced filters, and export a dynamic and static report. One of the first things we do as CHAS users is to log into the CHAS application. And each CHAS site is particular to its own NTF. We log in. We're going to click on the Continue button. And once we log in and get to our dashboard, we're going to go to our Apps module and look for List Manager. And this is the List Manager module. If you notice in the first section, it says Show Patients For, Facility, Clinic, Team, Provider, which is selected right now, and List. Now the Provider and List can be selected here in this module, or you can go back to Setting Preferences and say, well, I want Team Mockingbird, and then your preference will be selected to Team Mockingbird. But here in List Management, it gives you the option of selecting whatever team that you would like to pull data from. Okay, so and also you notice that we can limit our team to patients and to a provider and list. The second line here, you notice it says Create New List, and that is only if the provider or the nurse or even the med tech can say, well, I want a particular list for my login. And we're going to talk about that here in a few. The Advanced Filter section, which is the third section down, is exactly that. But now we're going from a general list, which is the Show Patients For section, to now a specific list what I want out of my CHCS data, and then we will get into. At this time, you notice I already selected a list down here. Last name, first name, social, all the pertinent data. And you notice they have red X's. That means they have test dues. Okay, to access List Manager section. The user needs not only a CHCS account, but the following security keys: KWMS1, KWN1, KWT1. Now, in setting preferences, when you select those applications to be loaded into your user view, Each little section has a little blue button that says More. If you click on More, it will tell you what the application is, a basic overview, and what security keys are required. What does List Manager application do? It provides the user to create and display a list of patients, chronically ill patients specifically. And there are two types of reports: dynamic, which is a canned standard report, which we saw in the first line, and static ad hoc reports. Those are your create my patient list, advanced patient list filters. Okay, now a dynamic or canned report basically pulls a list for the clinic, the facility, the team, the provider, and or list that you had created. Those lists cannot be manipulated, and that's why they're called canned reports, because it is a standard report. Static or ad hoc reports. A static ad hoc report can pull specifically last name, first name, diagnosis, CPS, clinical preventive services overdue, so forth and so on. Those reports, static lists, static reports, can be manipulated and adjusted accordingly to the user's needs. Okay, let's talk about dynamic list. There's specific predetermined criteria based on the following list. Facility list displays all patients in panel to all providers assigned to your facility. The term in panel means all patients assigned to your facility, but that doesn't mean that you get a maybe less than 10% of patients walking off the street from another MTF coming into your clinic. There's a check button, which I will demonstrate, that says non-in-panel, which are non-assigned to your facility, can be pulled. Clinic list displays all patients in panel to all providers assigned to the clinic. Team list displays all patients in panel to all providers assigned to a team. Provider list displays all patients in panel to the provider selected from the drop-down list of providers assigned to your facility. Now there again, when you pull these lists, and it goes without saying that all users will have a CHCS account. Nurse Nancy, at this time, will select a dynamic report for her clinic and team so she can track all her diabetic patients that are assigned to her facility. And there again, this is a canned report. Okay, this is my CHAS portal. I'm going to go ahead and log in. I am logging in. Okay, like I did with the slides, I'm going to click on my continue button. Now I'm here in my portal dashboard application. I'm going to go to my apps, which brings up all the applications I've selected in setting preferences. Highlight List Manager. Now I am in my List Manager application. On Show Patients For, I can actually click on Facility. I'm going to demonstrate each section. Give my application a little time to think. And you notice once it clears up, all my patients from my facility come up in alphabetical order. And under here, if you notice on the right above the patient name, it says filter criteria, which is Keesler Medical Center, limit to all my patients, non-impaneled, no. Now, like I was saying earlier, that if I wanted to include my non-impaneled patients, I would click on this little box that says include non-impaneled, which means patients not assigned to your facility. Those patients who come in off the street say, by the way, I'm from another facility, I still need to be seen. Next tab I'm going to click is on clinic. And it brings up my patients for my particular clinic. Team, you notice that Family Health Red Team is my selected team. I'm going to click on Team. And all those patients assigned to my health team appear. I'm going to select provider since I already have one provider selected. And if I really notice that once I selected the provider button, I can hit my drop down and I can select any provider I want. At this time, I'm going to select Brooks Deborah W. And apparently she doesn't have any patients assigned. And the last button to select at this time is List. And you notice I had already set up this list, and these are all my diabetic patients. One of the things that Nurse Nancy could have done, which is it is her job to keep track of her diabetic patients prior to be seen by a provider, to making sure their cholesterol, their sugar, all that is done prior to seeing a provider. And this is how Nurse Nancy would keep track, by making a list, naming it DM, Diabetes Mellitus Patients. And that's how she would select it. And you notice by selecting that down here, I got patient name, last four home phone, test due. Every time you see a red cross or red X, you will see that denotes that a test is overdue. List named where they belong, address, and so forth, so on. And by clicking on under these names with the line, you notice that it says patient summary for Abbott. And we've already in the last class know what patient summary module does. Now also too, I can go limit patients to, but I want to select it for my facility. Hit my drop down, and here I can select who are diabetic, who visit the ER, who are admitted, who have appointments, and who are overdue. And Nurse Nancy says she wants all her diabetic patients. I'm going to select it for the whole facility. Click on who are diabetic. And you notice it brings me a list of all patients who are diabetic within the facility. This tab can also apply for clinic, team, and or provider. Any questions? Okay, we're going to move right along. All right, we already talked about dynamic lists. We already selected a dynamic report, and I demonstrated. And I did my demonstration for dynamic lists. Let's talk about static list. A static list is two types, a create new list function and an advanced function, okay? And a create new list function, just like Miss Nurse Nancy did, was she pulled all her diabetic patients for her clinic, her provider, and her team to keep track of them, see how they're doing, and to ask all those questions that a nurse can handle prior to seeing a provider for a more serious issue. Okay? And a static list can add and remove patients to a configured list, and also can be shared with other providers and display comprehensive subset information for high-risk patients. There again, I selected diabetes because that is a high-risk patient, but I also can deal with asthma, also do high blood pressure, so forth and so on. Okay, there are filters within the reports. And one of the things that is really, that I like about List Manager is because of the red X and the yellow tennis ball, which are indicators for clinical patient service overdue indicators. Okay, red X indicates a test overdue for whatever it is, a pap smear, mammogram x-ray, cholesterol, so forth, a PSA. And the yellow tennis ball, if you see it next to your patient, is a test due within 60 days. And that's just a warning. Okay, now, on that note on the bottom, it says all unsafe filters are automatically deleted by midnight. What that means is when you made a My Patient list or a new list report, if you don't give it a name, the system will automatically, because if it stays with as new list, the application will delete that report by midnight. That's what that note means. Okay, now within these static reports, there are also sub-filters within that, and one of them is a sensitive list. Every provider or nurse or a medic creates a list and selects sensitive list, then only the user can see the list. Shared list. When a provider creates a list and he wants to share with another fellow provider, he has two options with that user, is read only, which means allow just to see the patient list, or full access, which means they can add and edit patients on that list. And you can also copy from a previous existing list. If I had already created a cardiovascular patient list, and I know some of those patients are also diabetic, I can actually merge that with my new list, name it, and I can edit it and save it. Okay, at this time, Nurse Nancy will create a static report, My Patient List, and she's going to add patients to keep track of the patients that are assigned to her. Okay, we're back to List Manager. And the second section where it says create new list, I want to create new list. And here's my create new list for me. And I'm going to name it My Patients. List description. Okay, those subsection tabs that I just talked about a few minutes earlier. Sensitive list, if I select yes, then I'm the only one that can see the list. If I select a shared list, then I can select a provider and give them either read-only or full access, or copy an existing list. I'm going to leave it as is. Go to the bottom, click Create List. And you notice List Manager in section number 1, or the first section of this module, went automatically to My Patient List and went to My Patient List button. Now, if I wanted to add patients, I go to section number 2, and under section number 2 I can create another new list, modify this list, delete this list, add patients by name. I can actually select those favorite patients of mine, or remove patients. But at this time I'm going to go to Add Patients and select. Now it opens up another box and same module, but now I have the opportunity to select where am I going to select my patients from. I'm going to go facility. I want a big, wide option. So at this time I'm going to select first patient, third patient, fourth patient, and the 6th patient. And you notice that the patients I did select have a test overdue. So I'm going to go all the way down to module. Here on the bottom, I can change my page to 1, 2, 3, 4, 5, and go directly there. Or my patient list size, I can make it to 50 list if I wanted to. All right, once I select my patients, I go to my Add Patients button, click on it. You don't see anything. That's okay. I'm going to go back to my team. Brings up my patients. Go back to my list. Hit my drop-down list. Select my patients. And now the patients I selected now show up. Now I, as the nurse or the medic, can keep track of my high chronically ill patients, make sure that they get all those clinical preventive services required to them completed prior to seeing my provider. It is that easy to create a list. Now, if I wanted to modify my list, go back to section number 2, click Modify. And when we modify my list, basically the modification is either name, description, sensitive list, shared list. That's all that is. If I wanted to remove patients, I would click on Remove Patients. No patient selected. Okay, that's okay. Click OK. I'm going to select Abbott Freddie, and then go over here, click Remove Patient. And it asks me, are you sure you want to remove this selected patient? I'm going to click OK. And I am down to 3 patients instead of 4. It's that easy to edit, modify, delete, add patients, remove patients. Any questions on how to create a static list and modify, add, remove patients? My apologies, Ms. Linda, I just saw. The ER visits, are they based on payment data? No, they're not. All visits are based upon the CHCS data entry. Does that answer your question, I hope? You know what, ma'am? This is what I'm going to do for you. I'm going to pull an ER visit list. Okay? Except I am going to select for the facility. Now, be in mind that this is a training application. It's not connected to an actual live CHCS unit. So if we don't pull any ER visits, that is why. So I'm going to select Keesler Medical Center. I'm going to go to Who Visited ER. And you notice that here under My Options, less than 7 days, I can set it to how many ever days I want. I'm going to click OK. And there again, like I was made a note a minute ago, that this is not connected to a CHCS unit, so this is training data, and that's why we won't find any ER visits. Now, on the ER visits, I'm not sure, but I'll tell you what, if you put your email address in the chat box for me, I'll get you an answer. How's that? Okay, let's move right along to the advanced filter. All right, the advanced filter pulls the following criteria from CHCS. By ICD-9 code description, code or description, by CPT code, by DRG codes, medications, RX, labs, ICD operations, and procedures. And this is specifically for your user managers, okay? And also the providers. Depending on why you need the data. 9 times out of 10 when we talk about ICD-9, CPT, DRG, and we're talking about user managers who want to know about trends, rates, stats, about what's going on within my clinic, my team, and or my facility. This advanced filter is great for user managers because they can pull that specific data. For providers, it's a great option to pull, okay, what's going on with my patient in the lab section, what was his medications on, and or procedures. Okay, Dr. Phil will create a static report using advanced filters to pull patient-specific data for patients that are over 5, male, and had a PSA lab completed. Because he wants to know within his clinic, within his list, how many over 45 miles have gotten their PSAs, if not. Okay, and how we do that is, we go down here to the third section, Advanced Filters. I want to create an advanced filter. I want to click on that. And it brings up this module here. Okay, and you notice I can do it by birth month. I can do it by age, which I need 45, anybody greater than 45, or anybody less than 45. I can do it by male or female. I'm going to say male. I can also do it by last name initial if required. And also by status, active duty, which I'm going to leave alone. Now look up by the ICD-9 code, International Coding for Disease is 9th edition. Okay? And you can look either by code, if you know your ICD-9 code, or description. I'm going to put description. And you don't need to spell it out. All I did was put RESP, and it brings anything associated with respiratory. Next tab, ICD, Operation Procedure. I'm going to go to description, and I'm going to say appendectomy, A-P-P-E-N-D. I don't know how to spell it, so that's all I'm going to put. And it brings up code 47.91, episiotomy. It's that easy. CPT code, coding procedure. There again, I'm going to put tonsils. And it brings up for tonsillectomy. And that's just proving my point that you don't need to know how to spell it. All you got to do is take the first 4 or 5 letters, and place in there. Same thing with my DRG code. I'm going to put description. RESP. And it brings everything associated with respiratory. RX, self-explain. You put any medication in there, it will bring it up. Lab, which I need. And it brings up, these are your labs that you can pull from this system. So I need a PSA, prostate serum analysis. Okay, now I need a PSA. I just want to find out if there's anybody with a PSA greater than 100. Once I put my information in, I click on my button, says add. And these are my advanced filters guidelines. I want everybody older than 45, all males, with a PSA of greater than 100. Once I put my required filters, I'm going to click on execute. And fortunately for me, that within the last 12 months, males over 45, PSA greater 100, there is none. And that's a good thing for me as a provider, due to the fact that if I had anybody with PSA over 100, then I know I need to call that patient in to say, hey, we need to talk about your prostate. And that is how you would do an advanced filter. You notice that under advanced filter, it says new filter. I haven't named it yet. If I leave it in here, then the CHAS application will delete that filter by midnight. If you have any advanced filters that you've created or your provider has created, by all means have them name it so they can pull it anytime they want. I click down, and you notice I have one other filter in here, high glucose. I'm going to go ahead and click on high glucose. And you notice to the criteria, my age for high glucose is greater than 50, male, active duty. Lucky for me, I don't have anybody with a high glucose count. There again, I need to bring them in to do a diabetes workup, because if they have a high glucose, there is an issue. Any questions on the advanced filters? The advanced filters is more specifically, they're again guided toward the provider. But a healthcare manager who needs to pull statistics, trends, and rates for their clinic, their facility, they would find this application very useful. Any questions thus far? Okay, at this time, Dr. Phil is going to create a new patient list, and he's going to share it with another provider. Okay, Dr. Phil says, okay, I'm going to create me a list for me. Create new list, and I'm going to say chronic patients. Now, I'm going to say sensitive no. I am going to select shared list, click. And you notice shared users comes up. I'm going to click, there's a little blue tab above shared users. Click add, user. Brooks Deborah, all I needed was the first 3 letters of her last name. Click on it. Read only or full. And there again, that is up to the user. The only reason I would recommend read-only and not full is due to the fact that if you don't want that other provider to modify your list, then it would be read-only. I'm going to give them full access. I trust that other provider. Click Add. And you notice the username comes up, what clinic they're under, what access they're given. And I can here at this time in the first column, I can either edit again, go back to read-only, or I can remove this patient. Create list. Now you notice that CHAS automatically went to the list button and selected chronic patients. And if I wanted to, I can add patients at this time for this list. It is that easy to create a list and share with another provider and or nurse or med tech. Any questions? Miss Linda asked that, is the shared list limited to a provider? Can I find an LPN or RN? Yes, it's not. You can find an LPN or RN. Basically anybody within that facility that has a CHCS account and a CHAS account. That's the only limitation. Because sometimes, I'm not going to talk about RNs, but LPNs and med techs, if they don't have those CHCS keys assigned to them, they won't have access to the List Manager module. That is the only limitation. Do they have those keys required to get into List Manager? I hope that answered your question, Ms. Linda. Alrighty, let us move right along. Okay, one of the easiest parts about this is we can export a dynamic or static list, which is, I think, very good because there again, if you are a statistics person, like stats, trends, and rates, you can export this into an Excel spreadsheet, which everybody knows you can pivot tables, charts, and graphs. But here's the following information that Excel asks when you export your information. Patient name, last four, home phone, age, birth, date, sex, active duty, test due, provider, address, city, state, and zip. At this time, Nurse Nancy is going to pull a report in her facility. She's going to look for patients that have had 3 appointments within the last 4 months and export it to an Excel spreadsheet. Okay, one of the first things Nurse Nancy must do is says, I want it for my facility. She's going to click on the facility button. And then she's going to go all the way to the right, says limit patients to, and go to who have appointments. And you notice the appointments section brings up a little module, says show patients that have had greater than 3 appointments. I'm going to switch this to the last 6 months, and I'm going to click OK. And it brings up all my patients within my facility. If you notice here to the right, number of visits, greater than 3. You can select 1, 2, 3, 10, doesn't matter. And also you're under like next session we're going to talk about what we call high utilizers list. And here under List Manager you can basically do the same thing. Now that pulled my list, upper right hand corner. There's a little blue button that says export. And I'm going to hit do that at the time. And it says export to Excel. I'm going to say okay, export. At this time right now, the AF.mil CHAS is thinking, pulling my data. And it's asking me, do I want to open my Excel? Let's say open. And if you notice, here is my Excel spreadsheet. And at this time I can save it, but I'm not going to. I'm going to leave it at that. And that is how easy it is to pull a report. Any questions on pulling a report? Now there again, like I said, depending on what stats you want to pull up, depends on how flexible the report can be. But for the user managers, those who manage clinics and are crazy about stats, trends, and rates, can use this Excel spreadsheet. Any questions thus far? Okay. Let's talk about workflow. What can I do with List Manager? What can it do for me? List Manager can track patients who are overdoing tests and create orders prior to test point with a provider. And what that means is Nurse Nancy or MedTech John was given the assignment by the provider that says, this is what I want you to do. I want you to track all those people who overdue clinical preventive services. There again being the pap smears, cholesterol, high blood pressure due, sugar tests. And the provider would tell them, track those people for me, set up orders for them, I'll sign off on them, and I want that done prior to that patient comes seeing me. Okay? And that's one of the ways that list manager can help a clinic. Keep track of those people who are overdue clinical preventive services. All right, create a static list for chronically ill patients. There again, diabetes, cholesterol, asthma, high blood pressure. So health teams can track better track of clinically ill patients. Instead of patients with that are chronically ill get lost in the shuffle. And that's what list manager can do. Provider can also use an advanced filter to pull specific chronic data, like, okay, what was your PSA last time? What was your cholesterol level last time? And so forth and so on. Okay, and you can export and save a static report. And this one thing I've learned is that out of all the modules within CHAS, List Manager is the easiest to use, because if you know what you're looking for, you can pull that data out of CHCS. Any questions thus far? Ms. Linda has already asked, I attempted to add a shared user who has a CHCS access and got kicked out 3 times. Yes, the person has to have a CHCS account, 1. 2, she is supposed to have a CHAS account. They have to talk to each other. And also, too, there again, I'm going to go to a third one is, they have to have the security keys for that module that you wanted to share with your associate. Does that answer your question, Ms. Linda? Okay. Alrighty. During this session, we discussed about accessing a list manager module. We talked about the CHCS keys required for list manager. We identified the difference between a dynamic and static report. We created a My Patient list. We created a static report using advanced filters. We saved a static report, edit a static report, and export a dynamic and static report. And there again, you can save these in Excel spreadsheet, which is a great thing, because you can do pivot tables, graphs, so forth and so on. Okay? Okay, check on learning, real quick. What are the 2 major list manager reports? Real simple. Dynamic, which are canned reports, cannot be adjusted, and static, which are we call ad hoc reports. They can be adjusted according to the requirements of your report and or list. By all means, anything and all items that we talk about in these sessions is here at the Air Force CHAS video tutorial. By all means, please go there, and it goes anywhere from basic level all the way to advanced user. And it's a great site, because the little videos are like maybe anywhere from 3 to 5 minutes. The biggest one I think is like maybe 9 minutes. So it's a great site to go to. And if you need to contact us at the STS site, CMIO, OTSG, here's our URL, otsg.cmio.sts@amed.army.mil. And please visit our ACE site. It's a great medical applications referral site at https://mitc.amed.army.mil.sites./CIO/resources/ACE. Okay? Next month's CHAS training topic will be proactive patient manager. Any questions? Ms. Linda, don't forget to put your email address in the chat box, please, so I can get an answer for your question. Everybody have a nice Army day.